Welcome to Week 6, the musculoskeletal, neurological, GI, and GU systems. Again, this week we're looking at chapters 21 through 26. Another difference this week is with the genitourinary systems. These are optional. If your patient is uncomfortable with you completing that portion of the exam, those may be omitted for your patients. You can still discuss with them some of the preventative things that are appropriate for their gender. The abdomen, with this you'll need to, again, as always, review your anatomy and physiology. If you need to, review your subjective data. What was the history? Because now we're in week 6, perhaps you don't recall the history for this portion of the exam. Make sure you have any equipment, and make sure you have a comfortable area for this patient to be able to inspect the abdomen. They need to be laying flat on their back for you to be able to do that. You're going to, of course, inspect the abdomen first, auscultate bowel and vascular sounds, then percuss the organs, palpate, and then observe for any abnormal findings. More than likely, your patients are healthy. Not always. It depends on who you choose to evaluate and to assess. So you may have some abnormal findings in any of these systems. Remember, percussing organs does take practice, so you will need to take that into consideration. If you're and watch the videos, I keep talking to you every week. I remind you because the Evolve has some great videos for this assessment course on the website that you have access to. In the musculoskeletal system, again, as always, review structure and function. Think about the developmental considerations based on your patient's age, whether you have a young person or an older person or a healthy adult. Again, subjective data. Are they having any discomfort? Are there any issues with range of motion? Remember, you're going to inspect, palpate, complete a range of motion, muscle strength testing, and then again, any abnormal concerns. And you can address these. Each of these are addressed in your textbook, so these can help you follow along and practice this along with your checklist. The neurological system, cranial nerves, I'm sure you have discussed those and checked those previously in assessment classes in your nursing career. These are a little more in depth possibly than you have done. Definitely checking reflexes in all limbs, assessing the sensory organs, and inspecting and palpating your motor system. The male GU system, this is again where you would discuss self-care, the testicular self-exam, whether they're of age for prostate cancer screening. Sorry, it's hard to wrap my tongue around that sometimes. And then, of course, if they allow you to complete the exam. The anal, rectal, prostate exam, again, this one is if the patient is willing to allow this. The female GU, again, review the histories. The HPV vaccine is available for the young females that are between, I believe now they've said age 9 and up. That's something to consider and to discuss with a parent if it's a young girl that the mother brings her in or the father brings her in, and those are some things to consider. You will then also, this is another one that is at the discretion of the patient whether you complete this exam. Again, it is discussed in the videos on Evolve if you have any questions about completing these exams, the bimanual and the pap smear and all those.